Today we're just going to be talking about this presentation, caring for the skin you're in. I'll touch on a few different things: dry skin, oily skin, mature skin, and we'll also touch a little bit on... Right, well, we like to put it anyway, and skin cancer also, as well as sun protection a little bit as well. So we'll go through that, and then I'll take questions at the end as well. So here we go. So first, dry and sensitive skin. A lot of people have dry and sensitive skin. We see this a lot in the office. Not only can you have dry and sensitive skin, just, in the winter time there are also medical conditions where you're dry or sensitive skin, eczema, psoriasis, different sorts of rashes that are associated with that. So overall, we kind of tell our patients generally this is kind of a dry skin regimen if you do encounter this from time to time. Bathing infrequently with lukewarm water, every other day or every couple days. Using a mild cleanser and moisturizing frequently. The two products that I really like the best for people with dry or sensitive skin is the Cetaphil product as well as CeraVe. Both of those products have natural oils and proteins that are found in the skin, and they kind of give back what the skin has lost. Your skin is supposed to be a barrier, obviously, keeping bad things out, good things in. When you have dry skin, a lot of times that barrier has broken down. So I find that these products really help rebuild that barrier and give you back what the skin has actually lost. Also, they're not greasy like Eucerin or Aquaphor or Vaseline can sometimes be a little slick or greasy. These products I've found are very nice for soaking in really well. Other things you want to be mindful of if you have dry or sensitive skin: avoiding wipes and scented products. Wipes like baby wipes, on small children. Also like makeup remover wipes. I see that quite a bit these days. Avoiding those, and avoiding scented products, lavender scented products. A lot of products like oatmeal baths, they actually do have scent in them. They're not as great for the skin as you would think, unfortunately. But yeah, like I said, the examples: CeraVe, Cetaphil. Vanicream is another one that's very bland for people with very sensitive skin. So those are things to keep in mind. Next, we'll talk about oily or acne-prone skin. We do see a lot of teenagers and adults with acne in our offices, and some of the things that we like to point out to those people is to use non-comedogenic products. That means it doesn't clog your pores. So anything that stays on the face, like makeup, sunscreen, moisturizer, you want to make sure it's non-comedogenic. And those two products I talked about before, CeraVe and Cetaphil, are both non-comedogenic. So those are nice to use on the face as well. Over-the-counter anti-acne or acne products usually contain one of two things: salicylic acid or benzoyl peroxide. Both are really great acne fighting ingredients. The one that I commonly refer to patients is the Panoxyl wash. It has 10% benzoyl peroxide in it. That's actually stronger than any prescription face wash you can get. It does dry out the skin a little bit, so we want to warn people of that, but if you have oily skin, that's great. And also, benzoyl peroxide can bleach things, so you have to be careful you wash it all off. Otherwise, you get bleach spots on towels and clothes and things like that. If those things don't really work to help with acne-prone skin, definitely see your dermatologist. We have many prescriptions, creams, pills, pads, washes, of course, that we help out people with all the time. And also, we do offer salicylic acid chemical peels. You can see here the before and after. The salicylic acid helps decrease a lot of redness and inflammation in the skin, so those are really nice to help out with some of the more acne-prone issues that we see in the office. And next is mature skin. So mature skin comes from time, of course, stress from the environment, emotional stress as well, stress on the skin, as well as sun exposure. And different ways that you can help prevent mature skin or fine lines, wrinkles, sunspots, things like that. Definitely use a moisturizer with sunscreen every day. A moisturizer with sunscreen should have at least 15 to 30 SPF in it. We'll talk more about sunscreen in a minute here, but everyday use of a daily moisturizer with sunscreen is really helpful for preventative measures, and that's one thing I tell people across the board: no matter what age you are, no matter what type of skin type you have, moisturizer with sunscreen is definitely something that I recommend pretty much to everybody.
Brand of that you recommend?
Not necessarily. Something
Soy low lay, okay?
Yeah.
I mean,
whatever works best for you. And then other things that are over the counter that I really like to help with some mature skin. Retinol is a great product if you can find that in any sort of over-the-counter product. A few of them that I've seen is like Rock or Neutrogena has a product with retinol in it, Neutrogena Nighttime. There might be samples over there as well of that one. They also have retinol in it, and that's the only chemical that has been scientifically proven to help with fine lines and wrinkles over time. So that's what we recommend to our patients. Other over-the-counter products that have retinol in it, the Avene Triacneal and the Glytone anti-aging products, those are products that I sell in my office, and as well as Dr. C's, we both sell those over there. And over here in Sterling, they sell the Obagi products, and that also contains the retinol in them as well. There are prescription strength tretinoin creams as well, so those are something that you can talk to your provider about. And we also offer chemical peels for mature skin. Chemical peels are great to help with fine lines, some finer wrinkles, as well as redness, dark spots. They don't help with pore size, unfortunately, but they do help with kind of retexturizing the skin surface and making the skin a little bit smoother for you.
what about facials?
Depends on the chemicals that are in the facials. The ones that we offer, the chemical peels, have glycolic acid or mandelic acid in them, or trichloroacetic acid, and those are ones that we're comfortable using to help retexturize the skin surface. So just depends on what's in them.
For a chemical peel, how long do the results last?
Depends on what type of peel you get. I usually tell people the glycolic acid peels are kind of our lightest, so more of like a refresher peel. Usually it lasts, I like to say, a few months, really, 6 to 8 weeks. And they just kind of get rid of the dead skin, they can retexturize the skin, kind of gives you that tight feeling for a few weeks, you know, and exfoliates that dead layer of skin off. We do have deeper chemical peels, the TCA or trichloroacetic acid peels, those are a little bit deeper. Those last a good 6 months to a year. I mean, those ones are pretty significant. On the flip side, you do have downtime with that as well. I mean, the skin literally peels off, so it's not one you want to start with probably, but
Don't do it the day before a wedding.
Exactly. So, yeah, so we kind of, get you used to them and used to the products as we're using them. But I love the Glytone chemical peels. They're very mild and they work very well for our patients. Skin cancer. So I'm going to touch a little bit on skin cancer here as well today. There are different types of skin cancer. We like to split them up into non-melanoma and melanoma. Non-melanoma types of skin cancer are non-life-threatening, for the most part. Unfortunately, if a squamous cell carcinoma or basal cell carcinoma gets too large and invades surrounding structures, it can be life-threatening, but that's very rare. Non-melanoma skin cancers include basal cell carcinoma and squamous cell carcinoma. This is a basal cell carcinoma, and this is a squamous cell carcinoma. This is just a picture I found online. This is an actual patient, and the whole ear actually was the squamous cell carcinoma. But anyway, non-melanoma skin cancers are usually caused by the sun. So, we see those based on a lot of people that have spent a lot of time outside, commonly in like farmers, people that have had a long history of sunburns, have very fair skin, didn't use sun protection very well, tanning bed use, things like that. So they're very much caused by external environmental things. And there also are precancerous lesions, actinic keratosis. We like to find these lesions early in people because we can treat them pretty easily with just cryosurgery, which is just liquid nitrogen. It's a spray. It's pretty simple to do in the office. If the lesion does progress to a basal cell or squamous cell carcinoma, a lot of times you have to do surgery to remove that lesion. So we try to avoid that as much as possible. And of course, melanoma. Melanoma is the bad type of skin cancer. Melanoma is caused by sun, of course, but it can also be influenced by your genetics. Melanoma, 10% of melanomas are caused by genetics. So if your family member had a melanoma, you definitely want to get yourself checked out. It just increases your chances slightly of having one if you have a first-degree relative with melanoma. Melanoma is the 5th most common cancer in men and the 7th most common cancer in women, so it's very prevalent. and it is life-threatening. It can spread to lymph nodes, other organs, and it's a very serious skin cancer, very serious cancer, and it's pretty scary when it does spread all over. So we take those very seriously, obviously. And we try to prevent them as much as possible by wearing sunscreen and using sun protection. I just wanted to touch really quick on the ABCD of melanoma. There's also an E, so we'll talk about that too. When you're checking yourself over for moles, you want to look for these different characteristics in a mole. A means asymmetry. Asymmetry means like if you have a sandwich and you fold it in half and the sides meet up, they are exactly the same. So if you can't fold your mole in half and it doesn't look the same, you want us to take a look at it. Doesn't mean it's bad, but you just want somebody to take a look at it. B is borders. If the borders are changing, like one side is growing faster than the other side, or it looks like a flower border or a scalloped border, then you want somebody to take a look at it for you. C, color changes. This is kind of low here, but there's many different colors in this melanoma here. There's black, dark brown, light pink, purplish color, a little grayish color in the center there. That's bad. You don't want that, obviously. So a lot of times when people notice a color changing in their mole, they'll have us take a look at it. And then D stands for diameter. Any mole larger than a pencil eraser, or 6 millimeters, you want somebody to take a look at. Again, it doesn't mean that it's bad, but you just want somebody to take a look at it closely and make sure the characteristics within the mole are normal. And E stands for evolution. It's kind of a newer one. But any mole that you notice is changing. So growing larger in size, itchy, bleeding, painful, anything abnormal like that, you want us to take a look at. And sometimes they're normal, sometimes they're not. There's a whole range between a normal mole and a melanoma. It can be atypical, it can be changing, it could be starting in that direction, and it's nice to catch those definitely early so that they don't spread to the lymph nodes and other organs like we talked about. Also, I just wanted to say, when you check yourself over for melanoma, make sure you check your back and the backs of your legs. That's a common location that people forget to check, and common location that we find melanomas. Okay, so how to prevent all this? Sun protection. Sunscreen is super important. Obviously, I've been kind of pushing that all throughout the talk, with wearing your daily moisturizer with sunscreen. SPF 15 or 30 is fine for just a daily moisturizer with sunscreen. SPF 15 blocks 93% of the sun's rays. SPF 30 blocks 97% of the sun's rays, and SPF 50 blocks 98% of the sun's rays. Anything after that's just incremental, 98.2, 98.5. It's not this linear thing where 15 is really bad and 100 is great. You gotta get 100. It really just kind of tops off at SPF 50. They're even changing now to where they're just gonna say SPF 15, 30, 50, or greater than 50. Because it really doesn't matter after 50 is kind of the generalization I'm making. There are also different types of light that is blocked by the sunscreen, UVA and UVB. So UVA is what causes your tan and what's in tanning beds. UVB causes sunburn. Both of those come from the sun, though. UVB is what makes vitamin D in your system, not UVA. So we'll talk about that in a little bit when we talk about the tanning bed thing. But UVA and UVB, that's what they mean when they say broad spectrum. It covers both UVA and UVB light, which is important to look for when you're looking at a sunscreen. Also in sunscreens, they have chemical blockers and physical blockers. Chemical blockers, they filter the sun. Physical blockers actually reflect the sun. So I prefer to, when you're looking for a sunscreen, you want to look for the physical blockers. Those are like zinc, titanium, a sort of metal like that. The chemical blockers can wear down over time, and again, I'm making a generalization. They haven't proven it, but when you're looking for a sunscreen, more and more dermatology providers are going towards physical blockers versus the chemical blockers. And then apply every 2 to 3 hours if you're just outside in the sun. If you're in water, they say apply every hour. So I know that's a lot. They're also changing the labels to be water resistant and very water resistant, not waterproof, because there is no waterproof sunscreen. Water resistant means that it contains the same SPF for 40 minutes in the water very water resistant means it contains the same SPF for 80 minutes in the water. So just a little bit more of the lingo and why things are changing, you know, and why they're trying to make the labeling a little bit more clear for people. But general rule of thumb, if you're outside, every couple hours reapply, and if you're in the water, every 1 hour apply your sunscreen. How much should you use? This is kind of cool. Nickel is the size of what you need for your face, and a shot glass is what you need for your whole body. A shot glass full, 1 ounce shot glass. So that's all you really need for your whole body. Not very much at all, but just make sure you get it everywhere. Sprays are great. Sprays are fine. Just make sure you kind of rub it in afterwards so you don't have like that spray line because it's not even. So, yeah. All right. And like I said, we talked about tanning a little bit too. The vitamin D myth, you always hear like, oh, I need to go to a tanning bed, or I always hear, because I don't have enough vitamin D. You know, or my vitamin D is low, so I need to go to a tanning bed. Not true. Not true. Vitamin D is actually from UVB light more than UVA. Tanning beds are full of UVA light, so you're not getting any vitamin D from the tanning bed. So, you know, that's not an excuse. Actually, most of your vitamin D comes from food anyway, so eat your vegetables, and you'll have your vitamin D. Also, obviously, you can see here, tanning is really bad for developing skin cancer. Skincancer.org is where I found this quote. And that goes for, it doesn't really say, you know, on a speculum, you know, if you go twice, you're fine. If you go 10 times, you're not fine. It really just depends on your skin type and, you know, how much sun you've had and if you burn really easily, things like that. So you're obviously just looking at this, though, you're definitely more likely to develop skin cancer, even life-threatening skin cancer, as you go to a tanning bed. Also, tanning increases wrinkles, brown spots, and weakens your immune system. So in case you needed any more reason to not use an indoor tanner, you know, it just makes the anti-aging process much more difficult. So, you know, we'll go through that. Next is a video, and this video looks at sun damage. There is melanin in every different type of skin. You know, some people have more melanin, which is what blocks the sun. Other people have very little melanin and are more fair, but everybody across the board can have sun damage and can develop skin cancer. So I thought this video was really cool to show how sun damage develops and why it's so important to wear sunscreen and to protect your skin from the sun. So we'll watch this real quick.
Didn't mean to do that.
I won't live up to any expectations. What you see is what you get. And worse yet, I can give an explanation
So I just thought that was cool how, you know, when they put the sunscreen on, you can see how it really blocks that UV light from the sun and how it works to really protect your skin, and just thought that was a really neat representation of that. And also, you know, how you can see the sun damage that some people have, and, you know, it's not quite apparent when they're in their 20s or 30s. It becomes more apparent when, you know, they're in their 60s or 70s and you can't go back in time. So, you know, it's nice to know to wear your sunscreen now and really protect yourself now, and that will help prevent any problems in the future as well. All right, any questions? I already answered them all, huh?
My skin all of a sudden got really red and sandpapery out of the blue.
Okay.
Like my eyelids right now, I mean, I don't know if you want to touch them, but I mean, they are like, and I don't know what happened exactly. Like I
Okay.
have these, I always had really soft skin, and it was just, one time when I had the flu like a few months ago, and I noticed during that, but I did have a tub of that CeraVe.
Oh, yeah.
And when I did, it was so bad. I just took a bunch of it and just slathered it on like moisturizer and everything. And after a little while, it was totally gone.
Good.
But I don't understand why all of a sudden it just was like, I mean, there's like these thick patches almost like that are just.
It could be a number of different things, you know, if you changed any topical products or if any detergents changed, anything like that would be something to consider.
And my neck too gets it, and I'm thinking it's like from my pillow or something, you know, but it's like nothing's different there.
Mm-hmm.
But
Yeah, everybody's a little bit different. You know, I would say try to keep things as simple as possible, and, you know, try to maybe work things in like one at a time, one every
To
2
see
days
what-
to see if something might be causing that reaction to
Right.
occur. You know, try to keep things as bland as possible for a while.
And I'll just keep with the moisturizing and the SPF.
Yeah, the sunscreen.
Right.
Yes.
Can medications you put in your eye come out through your sinuses and affect your face?
They don't really come out through your sinuses, but they can come out like in the crease here. Sometimes we'll see an allergic reaction from eye drops or medications in the eyes that cause irritation around the eyelids in this area.
They don't go down your face?
They don't really go down, no, like not in the sinuses and then like out that way. So, no, that wouldn't be something that I'm familiar with. Yes, sir.
They change any recommendation on wearing clothing or types of clothing, or, you know, you see product?
They're working on that right now. They're working on how to label that. The UPF, which is ultraviolet protection factor in clothing, is something that they're starting to market right now. Now they have like UPF 0 to 25, 25 to 50, 50 to 75 type, and basically that means kind of the tightness of the knit and keeping out the UV light. It doesn't correlate to sunscreen quite yet, but definitely recommendations are, you know, wearing long sleeve clothing. Dark clothing is actually better than light clothing. Cotton or a tight knit like jeans are the best to help reflect or not absorb as much sun.
What about swimwear?
Swimwear, like I said, some swimwear now is working on the UPF factor, but you have to really kind of search it out. There are a few companies that make that, but again, you have to look pretty hard for those products that have the sun protection in them. Mm-hmm. Yes, sir.
Do you have one of those ultraviolet lights in your office?
I don't have one, but I have heard actually one of our reps for the products that we have, the Glytone rep. She does have one of those as a facial camera. And, you know, if there's interest, I can always talk to her about coming out and seeing if that's something that people are interested in, seeing if, you know.
It'd be interesting if you went and had your picture taken.
I know, right? And see that and see, like,
Pass out on the way out.
right? Yeah, unfortunately, yeah, you can't see that until, you know, later on in life, and then it's almost too late. But it would be interesting to see, you know, sun damage in different skin types for sure. Yeah. Great. Yes.
Fish oil helps your skin?
You know, I haven't read any studies on that, so I can't really comment. I try not to, you know, I don't think it's bad for you. It's one of those things where if it works for you and it's something that you feel like helps out your skin, great, use it. I haven't really read any studies that scientifically say, yes, fish oil, yes, vitamin E oil, you know, yes, coconut oil helps your skin. But I do hear those things commonly in the office, and what I tell people, you know, or patients, I say, you know, if it works great for you and it's not bothering your skin, absolutely, you know, go ahead and use it. If it's not interacting with any of your other medications, you know, that's something that you can definitely consider trying. I do know that biotin, collagen, and silica, you know, vitamins with those minerals in them do help with skin, nails, and hair. That's one that I have read about, and they do have studies on that, but I don't know very much about the fish oil in the skin.
Vitiligo.
Sure.
Is there anything to do, obviously you can't reverse that,
Sure.
but I have a son who has it, and so should he use as high a sunscreen as possible?
Absolutely. I think vitiligo is when you don't have any pigment in the skin, and
It's
so
patches, yeah.
sure. And so your body is unable to protect it from to make the melanin to protect you from the sun. So you're at a much higher risk of having sun damage in those areas. So I think it would be more important to protect those areas as best as possible. Absolutely. Great. Anything else? Thanks again for coming.